What am I? I'm a doctor. I trained in Trinity, qualified in '84, grew up in Dublin, trained after that in paediatrics in Dublin, public health in England, lived over there for 9 years. Both my kids were born there, in Yorkshire, in Leeds in fact. We came back to Skerries, partly by accident. We ended up living there, and I've lived there for the last 19 years. It's a long time. What I do is I'm a public health specialist, so I'm interested in why people become well, why people become ill, how they stay healthy. What can we do from a policy perspective? What can we do from a health service perspective to keep people well? Those are the questions I'm focused on. I've done a lot of work with the health service over the years. I've written quite a few reports for various parts of it. And I've always wanted to understand better how to organise health services, how to pay for health services, how to move information around health services. So the questions I ask are not questions about treating individual patients, that's what I used to do, but it's questions about organising ways of getting services to patients, to service users across the country. I've about 25 years experience working in public health, studying health systems, studying how they work, working with the Irish health system, working with health systems in other countries. So I understand that very well. I have a lot of experience working with computer systems, with information systems. Most recently, I spent most of 2013 and 2014 working on an IT strategy for the Irish health system. And in the course of that, I learned a lot more about how the system works, how information flows around it, how money flows around it. I have a lot of governance experience. I'm the chairman of the Irish Blood Transfusion Service. I previously did a lot of work with them on blood stock management, which sounds esoteric, but saved them a large amount of money. And I'm now responsible for the whole organisation. I've been a member of the Higher Education Authority, which is the regulator for the higher education sector. So I know the problems of the sector very, very well. I know the challenges, I know the strengths, and I know the weaknesses of the sector. And if I get in, I go to spend as much time as I can trying to strengthen the sector, trying to argue for more investment, but also more appropriate investment in the sector. I've done a fair bit of work in governance. I'm finishing a training programme at the moment on corporate governance. And governance is a big problem throughout the Irish public sector. There's a lot of poor governance practice. There's a very limited accountability for many of the things that go wrong. I think at the moment the Seanad is not in great shape at all. I think the way it's used by the Dáil as an escape hatch effectively is entirely wrong. I'm very concerned about many of the senators describe themselves as being the senators for a particular constituency. And I don't think that's right. I think that's completely the wrong way of thinking about the Seanad. If you're going to take it seriously, it has to have a distinctive role, and I think it does under the Constitution have quite a distinctive role. It has to be let exercise it, and you have to have people in it who have the capability to exercise that role. And that means a mixture of people. The Seanad is a revising chamber. The intent of a revising chamber is that you take legislative proposals from the other house and you go over them in the light of a wider range of experiences. So if we are going to have an upper house, we need to have a very, very careful think about how we elect people to it. There are things we could change in the morning. We could close the Seanad nominations on the same day as the Dáil nominations. The Seanad nominations closed, most of them, on the 29th of February, presumably on the basis that you'd know by then whether you were going to be elected or not. And the university nominations closed on the 3rd of March, again after the Dáil count had taken place. I think they should close on the same day as the Dáil. And that's an administrative instruction. It doesn't, I think, require legislation, and it certainly doesn't require constitutional change. But I think we need to have a wider look at how we elect the Senate. and we need to come up with a different way of electing the majority of the senators. That would be my personal view. Things I can contribute to, because there are many things that are important to which I have no particular claim for skill, special knowledge. I will, in those areas, I will listen carefully and make the best judgment I can on how I should use my vote. But in the areas I know about, I think we could do a lot in disability services that we're not doing at the moment. I think we should be taking a rights-based approach to healthcare and disability services. And that would be a big shift how we think about health. In terms of education, I'm fairly au fait with issues in primary and secondary education, because that's something because I've worked on children, and schools are a huge part of children's lives. I've acquired some knowledge of the issues and problems there, and I think I can contribute to that. I know quite a bit about housing policy and homelessness in particular. One of the things we do here is we train homeless agency key workers, who are the staff who work with homeless families and homeless individuals, to bring them back into housing. So I have a certain amount of experience there. You have to change drastically. The higher education system is now seriously underfunded, and I would be of the view that the quality of our higher education is declining. Many of my colleagues would disagree, but I think we are running into serious problems. At the moment, it's funded from general taxation. We also have the second highest university fees in Europe. We call them a registration charge. It's not a registration charge, it's a fee. I mean, we need to grasp that reality. The British charge £9,000 sterling a year, we charge €3,000 a year. More typical around Europe would be less than €1,500 a year. And I think that's where we should be going. I know from talking to people in the universities and the ITs that they've found more and more students dropping out because they can't pay the registration fee. And that's really suggests to me that €3,000 is too high. I would see higher education as an investment in the future, and I think we need to do it and we need to get it right. People are talking about loan schemes. There is an analysis that says that your generation, people born from the 90s up, are being hit in several directions. You're being hit by really high house prices. You're being hit by a major recession. You're being hit by increased costs for higher education, which is leading to greater levels of debt. You're responding by putting off family formation to your 30s. What impact does that have when you're 70? What impact does that have when you're 80? We're engaged in a huge social experiment. We're pushing out the age at first birth quite steadily. Ireland was always a demographic outlier in terms of age at marriage across Europe, and that had caused a number of social problems later on. We're now engaging in a very large experiment, producing a generation, your generation, that is much more heavily burdened than mine. I mean, I left college in the middle of the worst recession since the 1929 recession, until this one, which is even worse. So you're leaving college in a worse recession than the one I left in. And my generation are still recovering from that. A huge number of us emigrated. A lot of us came back. I came back. But very many of us had to leave the country. Very many of your generation are leaving the country. So we have to be very careful that we don't add additional burdens, costs and charges to you. I feel quite strongly that paying for higher education should be a matter of social solidarity. And whether it's paid for from general taxation or from a specific tax on all graduates, which is another option, I would be agnostic. But I don't think the entire costs of higher education should be put on the shoulders of future students, no matter what scheme is used to spread out those things.